My name is Orlando Max Avis. I work for SOS Méditerranée, and my role is search and rescue manager, but historically I've been crew and on-scene coordinator as well. It's completely vital. What we say in our organization, at least, is that we'd much prefer a solid team than solid equipment, and I know that's not a trade anyone should be making up, but I think we say it like that rather to emphasize something that often is forgotten. So without that feedback, you end up in a really dark place, frankly, with a lot of dysfunction, both practically but also kind of on a higher level. It's really dangerous because I think rescuers are often people who are so willing to give up so much for other people, take quite big personal risks, but if you don't watch that, you can bite off more than you can chew, and also, frankly, at the end of the day, not be very effective in the first place. So. Historically, being a leader, on a rescue scene, I think saying, guys, that was really scary, or, crew, that was really scary, and, I'm not feeling that good now, and kind of putting yourself at the front of the line there and initiating that culture is really important. And then that needs to be supported all the way up, because it's no point if everyone's like, I don't feel very good, and then there's absolutely no support or clarity. So clarity is essential on pathways, and then also confidentiality. If you don't have that lined up, it can be hugely destructive and really avoid people accessing services that are so needed. So. Again, essential, because everyone deals with their situation differently, but if it's not clear to crew, the less streamlined the process is, the more people fail to reach the support they need. So the clearer you make it, the less people involved you make it, the less steps to get your path done you make it. Basically someone needs to be able to pick up a phone and get support and not have to ask anybody else, and know, so the guidelines externalizes it from any kind of communication chain, makes it super clear for everyone and gets people to where they need to go. Picking up the phone is the hard part, I think, as an individual, not as an institution, so you've got to make that easy for people. We had, in terms of working hand in hand with the institution, was making sure it happened in the first place, alerting them to the fact that there was a problem, alerting them to the issues with the service provided when it was wholly inadequate, which it was for many years, and basically pushing that process ahead to get to, I think, where we are now, which is a much more effective mental health program.